Hey, welcome. Today, we're diving into one of your body's most incredible, but maybe most underrated systems. Think of it like a nonstop 24/7 purification plant that's always working to keep you healthy. We're talking, of course, about the urinary system. So let's get right into it.
Okay, just to give you an idea of the scale we're dealing with, let's start with this number, 150 quarts. That's almost 142 liters. It is the absolutely staggering amount of blood that your kidneys filter every single day. It's just an unbelievable feat of engineering, and it's happening inside you right now.
And this is the whole setup that makes it all possible. Now, I know this diagram might look a little complicated, but the concept is actually pretty straightforward. It's your own personal, super advanced purification plant. You've got your two bean-shaped kidneys doing the heavy lifting, the ureters acting as transport tubes, the bladder for storage, and the urethra as the final exit pathway. They all work together as this perfectly coordinated team. So let's talk about how this purification plant actually works. Its job never stops. It's constantly filtering out waste products, balancing all your body's fluids, and just generally maintaining the delicate internal environment that keeps you alive and well.
Each part here has a really distinct and vital job. The kidneys, they're the master filters. Then you have the ureters, which use these little muscle contractions to push the urine down into the bladder. And the bladder is this amazing, expandable tank. It can hold about half a liter. Finally, the urethra takes care of eliminating it from the body. It's so simple, but totally brilliant. But to really, truly understand the magic of the kidneys, we have to zoom in. I mean, way, way in. We're going from the big picture organs down to the microscopic level, because we need to meet the real hero of this whole story, the nephron.
Okay, check this out. It's a pretty intricate little structure, right? Don't even worry about all the different labels for now. Just appreciate the complexity. This is one single nephron, and your kidneys are packed with about 1 million of them each. This is where the real nitty-gritty work of filtering your blood actually goes down. It's a total marvel.
So to put it simply, the nephron isn't just part of the kidney. In a way, it is the kidney, at least functionally speaking. It's the tiny unit that gets the job done. Without millions of these little guys working in concert, there's just no filtration happening at all. And the nephron has this really clever 3-step process. First up is filtration. It basically pushes almost everything small out of the blood. Water, salts, nutrients, waste, you name it. Then comes reabsorption. This is where it carefully pulls all the good stuff your body needs, like nutrients and most of the water, back into the blood. And the final step is secretion. It dumps any leftover trash into the fluid that's left. And that fluid, that's urine, ready to be kicked out. But what happens when this perfectly clean, perfectly balanced system gets invaded, right? Like any purification plant, it's vulnerable to a little sabotage. And in this case, the saboteurs are bacteria, which can cause what's known as a urinary tract infection, or UTI. And the main bad guy in this story is a super common bacteria, E. coli. Now, normally, it just lives harmlessly in our gut, no big deal. But if it gets into the urinary tract where it doesn't belong, well, it's responsible for the vast majority of UTIs that people get. Now, not all UTIs are created equal. You can kind of think of them as having 2 different levels of attack. The most common one is a bladder infection, also called cystitis. That's a lower urinary tract infection. But, and this is a big but, if that infection isn't treated, the bacteria can actually travel up the ureters and get into the kidneys. That causes a much more serious upper urinary tract infection called pyelonephritis. So the key difference is just location, but that location makes a huge difference in how severe the infection is. So how can you tell if your system is under attack? Well, your body has its own alarm system, but you've got to know what you're listening for. Let's decode some of those signs and symptoms. For a standard bladder infection, the alarms are usually pretty loud and clear. You might get that classic burning or painful feeling when you urinate, or feel like you have to go all the time. You might even notice changes in the urine itself, and maybe you feel some tenderness right above your pubic bone. These are all very direct signals that something's not right in the lower tract. Okay, but here's where things get a little tricky, and this is so important to know. What happens when the body's alarm system sends a totally different kind of signal, one that's way easier to miss or to mistake for something else entirely?
In older adults, believe it or not, the signs of a UTI can be completely different. Instead of pain, the main symptom might be a sudden onset of confusion, or major changes in behavior, or just being incredibly tired and lethargic. It is so critical to know that these are not just signs of aging. They could actually be the body's main alarm bell for a pretty serious infection.
And if that infection has made it all the way up to the kidneys, the alarms get much, much louder. We're talking red alerts here. A sudden high fever with chills, a deep aching pain in your side or your back, that's called flank pain, plus nausea, and just an overwhelming feeling of being really, really sick. These are signals that mean you need to get medical care right away.
All right, so once those alarms have gone off, how do we fight back and get things back to normal? This brings us to diagnosis and treatment. This is where science steps in to identify that invader and, neutralize the threat.
The whole diagnostic process is pretty systematic. It'll start with a doctor just talking to you, reviewing your symptoms and your history. Next up is usually a urinalysis, which is a quick test that looks for clues of infection like white blood cells. But the gold standard, the definitive test, is a urine culture. That's where they actually grow a sample in a lab to figure out the exact type of bacteria causing all the trouble. That way, the doctor knows exactly what weapon to use against it. And that main weapon, in pretty much all cases of bacterial UTIs, is antibiotics. These are the drugs designed specifically to kill those invading bacteria, stop the infection in its tracks, and let your urinary system heal and get back to doing its important job. Recovery is really a partnership. So think of this as your battle plan. First, and this is the most important thing, you have to finish your entire course of antibiotics, even if you start feeling better. If you stop early, the infection could come roaring back. Second, help your body flush everything out by drinking plenty of fluids. And for the future, get help at the first sign of trouble and always go to your follow-up appointments, just to make sure that infection is really, truly gone. So let's just end with this thought. Whether it's a subtle change or a screaming red alert, your body is always talking to you. The urinary system is one of those silent workers, but its distress signals are crucial. So the real question is, are you listening? Because paying close attention really could make all the difference. Thanks for tuning in.